Hi, I'm Dr. Varma, and welcome to Thermometer. On this channel, I check the temperature of health in the United States and around the world and give you expert insights on infectious diseases and public health. This is our weekly episode of Inside Outbreaks. And on these episodes, I review the latest outbreaks of infectious diseases, the outbreaks that you need to know about. And I do this with my friend and colleague, Dr. Jon Epstein, veterinarian, virologist, and disease ecologist who, like me, has spent his career tracking dangerous infectious diseases across all corners of the earth. Thanks, Jon, for joining me today.
Thanks for having me, Jay.
Great. Well, today we're going to start with a topic. We're entering into the summer season here in the United States, and lots of people like to travel, and Hawaii is one of the most popular destinations, I think, for people. I think for some people, it's really the trip of a lifetime to get a chance to go to Hawaii, given, how beautiful it is, the beaches, the volcanoes, just all the natural beauty. But there was a report out about concern regarding Zika virus. And we know that Zika virus is particularly a concern for women of reproductive age or their male partners because of the association between Zika virus and childhood birth defects. So, Jon, looking at what we know, what do we know about Zika virus in Hawaii, and why are we talking about it today?
Yeah, well, it's an interesting story. And again, this is one of those examples where we should applaud the fact that a surveillance system did its job and detected a case. But this is a travel case. That means somebody was infected with Zika virus elsewhere and brought it in as a traveler. And so there really isn't much risk here of onward transmission, but we do have to be careful because the mosquitoes are present in Hawaii that have the ability to transmit Zika from one person to another. So it is something worth paying attention to. But it's also worth noting that in the original epidemic, when there were many, many Zika cases coming out of South America, there were travel cases entering the southern United States, and we saw very limited local transmission. Nothing ballooned into a big outbreak. But again, these surveillance systems are important to make sure that that doesn't happen.
Yeah, and so I think it's important for us to go through a couple of sort of epidemiologic principles for people out there to understand kind of why this might be a concern or why it might not be a concern. So the first is kind of what is the definition of a travel associated case? So a travel associated case means that some public health agency in collaboration with some medical facility was able to diagnose and verify that a person had Zika virus infection. So they probably were sick, went to their doctor, got tested, found to have Zika virus. That physician or that hospital facility or laboratory called the local health agency. Then the local health agency did an interview with the patient to try to figure out whether or not they might have gotten this infection somewhere other than Hawaii. So that's how we know in public health whether a case is travel associated or not. Now, the question becomes, as Jon, as you just pointed out, and I think what we need to educate and talk to people about is, how does a virus get introduced, particularly a mosquito-borne virus, get introduced to a new location, like an island like Hawaii? And, in general, it's really kind of two ways. And Jon, correct me if I'm wrong, but basically you either have to have one of two things. One, you have to have humans that get infected elsewhere and enough of them come into a setting, and that because you have the right types of mosquitoes, those mosquitoes have never seen Zika. They bite on the human who had Zika from another location, comes into those mosquitoes, and then they transmit it onward to other people. So humans kind of introducing the virus and local mosquitoes kind of feasting off of that. And the second version, of course, would be that the mosquitoes themselves are brought in somehow via a plane or, combined with some type of animal. So, Jon, what do you think about that? Are those really kind of the two main ways that a mosquito-borne virus enters an island like Hawaii?
Certainly, that's true for predominantly human diseases that transmit by mosquito. The third way would be an infected animal reservoir that comes in, either is blown in on the wind. Some birds or bats can be moved between islands that way, or transported deliberately or inadvertently via air travel or on a boat. So that would really be the third way. But I think in the case of Zika, even though we originally discovered Zika as a non-human primate virus in East Africa, but in the context of sort of modern spread of Zika virus, it really is a human virus that is spreading directly. And so, yeah, I think that's it. It's either mosquitoes come in infected or a person does, and then there may or may not be local transmission.
Yeah, and back in 2015 or so, when Zika virus first became a concern in the Americas, so all the way from North America to South America, I think it was believed that, people who had gotten infected it had gone somewhere from the African continent to the Pacific Islands. And
Hmm.
then as a result of, I think it was sports competitions or something, it basically, traveled, I think, with infected people to Latin America. And that's essentially how
That's
it
right.
then eventually spread and then eventually came into the
That's
United
right.
States that way.
We had known about Zika virus outbreaks in Micronesia and Southeast Asia back as far as 2007, but really, and we'd known about the virus since the 50s in East Africa in primates. But that 2015 outbreak that started in Brazil was wholly due to travel of infected people.
Yeah, and so this is, I think, why, even though this article that you can see if you click in the description of this YouTube video, even though that article is a little bit of a clickbaity article, right? Because basically, this is a person who got infected somewhere outside of Hawaii and was diagnosed in Hawaii. Even though this is a bit of clickbait, I think it's a really important educational case for us to talk about because, as you pointed out at the beginning, this teaches us why public health surveillance is so important because those first few cases that came into Brazil from Micronesia and those first cases found in the United States, they could be the start of a potential epidemic. And that leads us to want to take public health action. So the fact that Hawaii caught this infection early is important because this is the way viruses get introduced into islands. Humans get infected elsewhere and bring them into them. So John, I guess the question becomes something that we've mentioned before, but I don't think we can ever mention enough is what are the kind of mosquito control measures that would be needed if Zika virus does become a problem on the Hawaiian Islands?
Yeah, well, it's the standard ones they would use for any vector-borne disease. And number one, that's controlling mosquito larvae. So making sure there isn't standing water, particularly in public areas like resorts or where there are a lot of people, where standing water where mosquitoes can breed. So using larvicides, fogging for adult mosquitoes. And then, of course, at a personal level, we can do a lot to protect ourselves from mosquito bites. And that includes wearing long clothing, using repellent, and just making sure that we're aware of the environment we're in. The mosquitoes that transmit Zika virus are active during the day. So in this case, it really is. And it's hard to do in Hawaii, but you got to cover up if you're going hiking or you might be in an area where the mosquitoes are prevalent.
Yeah, and I really want to highlight to people out there the importance of standing water. When I was in charge of the New York City Health Department's infectious disease program and led the response to Zika virus back in 2016ish or so, I think is when we had our major response to that. It was really educational to me to understand like how critically important it was to get rid of something like standing water. Like I'd always thought of stagnant water in terms of large water baths or ponds or something like that. But I never realized that literally, and I'm going to bring out a little prop here, that literally the lid of a Coke can,
Yep.
where you can have like little water accumulations. If that's just sitting outside your house, that is enough water in the tip of that lid over there to actually have these larvae be laid and potentially be a source of mosquitoes. So if you care about mosquito control just because you don't want pests in your home, or you care about it because you want to reduce the risk, or all three of those, make sure that anywhere around your home during the summer season that can collect water like this is consistently cleaned out and dried out.
Yeah. And, it's also a good opportunity to talk about Hawaii as an island ecosystem, because it's distant from the continental United States, because it is an island chain, it is somewhat protected from certain disease events that happen in mainland United States. But Hawaii has had its share of introductions of mosquito-borne diseases over the past. And namely, I'm thinking of one, avian malaria, which has devastated local bird populations, and tropical birds have been so important to island ecosystems in Hawaii. And the second is West Nile virus, which also made its way to Hawaii eventually via infected mosquitoes. And that impacts birds as well. And so Zika doesn't necessarily impact local wildlife, but that's just to say that even though Hawaii is an island, it's not completely safe from introduction of disease. And so we do have to have vigilance and monitoring that. And because Hawaii is so heavily trafficked by tourists, this is why we have to pay attention, whether it's Zika or any other tropical disease that could establish itself on the island theoretically.
Yep, and absolutely. And just as a reminder to people, one of the main reasons we worry about Zika virus is because of its potential impact on mothers and babies. In regular, sort of the average person who is non-pregnant, most Zika virus infections, first of all, are never even detected. People don't have any symptoms at all, but if you check their blood, you'll find it evidence of infection. Some percentage of people, however, do get symptoms and can have a fever and achy joints and feel like they have sort of the classic flu, but in fact it's Zika virus. A subset of them can get more severe infections like brain symptoms, but that's pretty uncommon. But the group that we really worry about the most is women who are pregnant.
Hmm.
And it turns out that if a woman is infected while she's pregnant, or alternatively, gets infected by the semen of a male partner, there is a risk of that child being born with what's called microcephaly, or a very small brain, and other types of birth defects. And so it's really, really important, particularly if you are pregnant, or you're thinking about getting pregnant and you're not on reliable birth control, or you have a male partner that's going to one of these places, to really think even more carefully about mosquito prevention than you might normally.
Well, and you brought up a really important point, Jay, is that with Zika virus, although mosquito borne spread was the main route of transmission, we also learned that it was sexually transmitted. And that was another way it could be spread, even if you didn't think you were bitten by mosquitoes, or you weren't in an environment where, you'd be exposed to a lot of mosquitoes. It's sexually transmitted. And what made Zika so difficult to control was that, as you said, most cases were asymptomatic. So you might not even know you have it, and you could potentially be spreading it. And so back to the context of Hawaii, there's no evidence for onward transmission. It was an isolated case, but these are some of the things public health authorities have to be thinking about in order to make sure that there is an onward spread of Zika in this case.
Yeah. And so while we're on the topic, of course, of fast moving viruses around the world, it's time to talk a little bit about COVID again. There's been a lot of news
COVID,
recently.
what's that?
Exactly. Well, it's a hoax, right? It's a
No,
hoax.
yeah.
The one we don't need to worry about anymore. Well, it turns out there is a new variant that's being reported pretty actively. It's called the NB181 variant. And there have been lots of news reports and commentary by public health pundits, people that we know very well, talking about the concerns about this variant. So, John, can you bring us up to date a little bit? What do we know about this variant? Why is it something that we're talking about right now?
Well, we're continuing to track the genetic evolution of COVID around the world. And even though I'd say by and large people are testing a lot less, there are still laboratories and public health agencies that are sequencing viral isolates and monitoring evolution of this virus. So this is another variant that is an incremental change from previous variants that we've seen. Our understanding of it is that it is, as or slightly more contagious or transmissible as previous variants, causes about the same level of disease, and vaccines are effective against it. That's good news, but it's evidence that the virus does continue to evolve as it infects large numbers of people now around the world.
Yeah, and I think so. Just one sort of epidemiologic point for people to understand, like, it's very challenging for us as epidemiologists or virologists to answer the question: is this virus more transmissible than a previous strain of this virus? And I think one of the ways that virologists have to, and epidemiologists have to try to answer that question, is kind of by a proxy measure. It's not a direct measurement. In other words, you're not sticking, you know, 50 people in a room and dividing them
Mhm.
into two groups and having one be coughed on by the old variant and one coughed on the new variant and seeing how easily it spreads. What you're kind of looking at is when you have these systems where you monitor variants in a population so that everybody who has a lab test for COVID has their strain sequenced. What you can look for is basically how quickly does this new
Right.
strain take over and become the most dominant strain in a community, and the speed with which it becomes the most dominant strain in a community is kind of a proxy or surrogate measure for how transmissible it is.
That's right. So this one is kind of rapidly replacing prior strains in terms of the most common or prevalent. So that's a good way to explain it.
Yeah, and I would say that, so this is I think there are two things to talk about here. One is kind of, should we be worried? And my basic take right now is no more than usual. Okay, and the
Mhm.
reason I say that is because I think there's a couple of things going on here. First is that people have largely, at least most of the people that I know, including many in the healthcare field, don't really think much about COVID anymore. And they've basically accepted that this virus is now part of the landscape of all human infections that we get. Um, And so I would say, yes, that is in fact true that COVID is effectively endemic. And unlike the flu, which really primarily only has a winter peak, I mean, there's a very small bump sometimes in summer months. COVID appears to have a different type of seasonality where it comes in waves 2 or 3 times throughout the year. And during those waves, people should be concerned about protecting themselves. So that includes potentially using a mask, or if you have cough and cold symptoms, making sure you get tested, simply because you want to keep yourself healthy and you want to keep other people around you healthy. So I'm not super worried because I just don't think people haven't been paying a lot of attention at this moment. And my point is that they should at least continue to be as vigilant as they've always been, maybe not necessarily more so.
Yeah.
And then the second issue is that Omicron was really the big shift. I mean, that was the watershed moment for this virus. That was a completely dramatic shift in the transmissibility of this virus and some of the immunology of it as well, too. There was cross protection with previous strains, but not quite as much as you had seen with, say, the Delta variant before. And so I do think that because large percentage of the population has been vaccinated, has been infected, and both of those, that I don't see any evidence yet that we need to be particularly concerned about a new COVID strain bypassing that type of immunity.
No. But, you raised the point that we do still have to think about this virus. We were joking before that, people want to forget the pandemic, they're ready to move on. But I think at this point, too, many Americans who do have underlying conditions understand that that puts them at greater risk for significant disease with COVID, as opposed to, the general population that's healthy and has a lower risk of severe disease. And so it is worth noting that, people do still die from COVID. I think I just saw a figure today. I was looking at last year, something like 47,000 Americans died from COVID associated illness. That's a significant number. That's flu-like numbers in terms of an annual mortality rate. And so there are still a good number of people who are at risk. And it's worth mentioning that Moderna just had its next generation vaccine approved by the FDA, albeit for limited use. And how this will be different than previous vaccines is this one is a little more potent. It targets a part of the virus that will cause neutralization. You can use a lower volume or a lower dose of the vaccine to get as much efficacy in terms of reduction of risk of severe disease. And this one it's called next spike, but the point is that this will be available next year for respiratory virus season, and it will be recommended that those over 65 or those with underlying conditions do continue to use the vaccine, and particularly this new generation vaccine, because it offers important protection.
Yeah, and I have to say, I mean, this obviously brings up the issues of what's been going on with our federal government, with specifically with the FDA and CDC, and I just have to say that I'm absolutely incensed at the public statements that are being made. All these COVID contrarians, none of whom have ever practiced public health before, none of whom have ever run a public health program, are now suddenly all in power and thinking that they want to go ahead and rewrite the rules for how we approve and evaluate new vaccines and blur the lines between what FDA does and what CDC does. And I'm talking specifically about the efforts to pull back on the approvals for the COVID vaccine for people who don't have underlying health conditions.
Right.
So what they call healthy people, or healthy children in particular is who they're referring to, and pregnant women. And this is just a complete break from what we know about the science of it. The science of this is absolutely clear. And even if we just talk about pregnant women alone, something that we talked about last week, pregnant women are at extremely high risk of having complications from pregnancy, both themselves as well as their babies. So that's one issue. And the second issue is people who believe that they're otherwise healthy are also potentially at risk. And these vaccines are incredibly safe. They have been used hundreds of millions of times, repeat doses in individual people. I've gotten a booster dose at least once every year. So I'm up to maybe 5, 6, 7 COVID vaccinations that I've gotten. And I just feel right now that FDA is really kind of overstepping its role. FDA's job is not to practice medicine. It's not even to give medical guidance to how people practice medicine. It's to simply decide, is this vaccine safe and effective for different populations? And if so, it's up to CDC and other agencies to give guidance to medical practitioners. And I think that's what's really worrying me right now is that, as you point out, COVID remains one of the leading causes of death in the United States, both from acute infections as well as the chronic complications like clotting and heart attacks and strokes. And we're now seeing not only potentially new variants emerging, may or may not be a concern, but the virus is still evolving.
Right.
But our vaccine system is not keeping up with that.
Yeah. Yeah. No, this is something we can't just dismiss out of hand. And I don't know, we're going to have to, if the government is really putting the burden of understanding the science and making decisions about vaccination, then it just makes what we're doing all the more important to get the information out into the public to help people make those decisions, and hope that clinicians are also keeping up with the current literature and science, that they can make informed decisions about vaccine recommendations.
Yeah, I mean, because it has a lot of downstream effects, as you point out. Clinicians start to take it less seriously. And the bigger risk, however, is that insurance companies choose not to provide this vaccine. And even more important, one of our most important ways of delivering vaccines to people right now is pharmacies, right? Retail pharmacies are where a lot of people, it's where I and most of my family, where we get most of our vaccines.
Right.
When we have to get updates, whether it's flu or it's COVID, I just got the shingles vaccine. And they're not going to necessarily carry these vaccines if there aren't a lot of people actually accessing them, because FDA is putting more restrictions on who can get it and who cannot.
That's right.
Yeah. And so, I mean, I'll be very blunt. I mean, the advice I've given to people is like, hey, tell people, your medical provider is not going to restrict you if you say that, look, I'm overweight, so therefore I have a underlying medical condition. So that's kind of what you're going to be left to do if you're somebody that cares about COVID and you want to get a booster dose. And if you don't fall under one of the conditions it's named, they're written vaguely enough. I think one of them, even I have to go back and check, was something about like inadequate physical activity, which kind of applies to most of us.
Listen, we're getting into, I think, perilous times in terms of public health and personal health. And I think I liked it better when there's a little more guidance from, trusted institutions and frameworks. And so I just hope we can get back to that. But in the meantime, we're going to have to, put information into people's hands and also advocate to get groups like the vaccine group at CDC, back into the mix in terms of recommendations that FDA follows.
Yep. And on that note, as Jon is calling out to all of you, if you did like this episode, please share it with other people in your life, because as Jon and I have been talking about, the more we can make people aware about the importance of public health and the interventions that are out there that are safe and effective, the better we can all be for our communities. Builds our health, builds our wealth, keeps us around for a long time to care for the loved ones in our life. So please hit the like button. Please hit subscribe. Please share this episode. And we'll see you here next week on another episode of Inside Outbreaks.
Be well.